Van Der Beek is 47 years old. Colorectal cancer is one of 17 different types of cancer on the rise right now for Gen X and millennials. That's according to the American Cancer Society. That research published earlier this year. And joining us now to talk about prevention is nurse practitioner Alice Benjamin. Alice, welcome back.
Thank you for having me.
So when or at what age should people be screened on a regular basis by a doctor here?
So current guidelines recommend that the average risk person begin their colorectal cancer screening at age 45. However, if you have a family history of colorectal cancer or you have other risk factors like irritable bowel syndrome, you may need to start screening as early as 40 or 10 years before the youngest affected relative's diagnosis.
So are there symptoms when you talk about IBS or other things? Are there symptoms that you perhaps should see and then call your doctor or go in for a colonoscopy?
Well, the thing about colorectal cancer is sometimes the symptoms are very subtle. You might have some stomach cramping, some changes in your bowels. Perhaps you're having diarrhea or constipation, abdominal bloating. It could be you have some blood in your stool. Some very subtle things that people often attribute to other things. But whenever you have any of those symptoms, it's very important that you talk to your healthcare provider about them.
How often should you be screened?
Well, interesting question, because there are different modalities of checking and screening for colorectal cancer. The golden standard is the colonoscopy, which everyone knows is the long, flexible tube with the camera on the end. It's inserted into your rectum, and we view the entire colon. Many people are afraid of this test because it's invasive. But the good thing about this is doctors can go in and they can visualize for any signs of cancer, any other polyps or areas of concern. And while looking, they can actually do something about it, Colleen. They can remove those polyps. They can biopsy tissue. Now, if the test is normal, it's done every 10 years. However, if they do remove a polyp or biopsy, they may have you come back sooner, 5 to 7 years to do that. Now, for people who are afraid of that type of testing, there are other options. And patients ask me all the time, and there are stool samples that you can provide. One is called the FIT testing. That's the fecal-immunochemical test. It's a stool sample where we check for hidden blood, which could be a sign of a bleeding polyp or other cancers. No prep, non-invasive. You can do it at home. It's done annually. There's also the stool DNA test, which is also known as a Cologuard, and again, stool sample, but this is checking for DNA mutations and blood associated with colorectal cancers and polyps. It's non-invasive, no prep, can be done at home. It's done every 3 years. Now, because these are not direct testing for colorectal cancer like colonoscopy, it's done more frequently. And so there's the potential for missing cancers, but I'd rather you do that than do nothing. And then if and when those tests turn positive, then we will invite you for a colonoscopy where we can do further, more in-depth screening and testing.
Is this considered a fast-moving or growing cancer? And how much does environment have to do with it?
Well, it is the fourth common newly diagnosed cancer. It is the second highest cancer related to death there. And so one of the things is this type of colon cancer screening, it's often put off, Colleen, so it's missed a lot. Now, there are environmental factors. There's pollutants, there's chemicals, things like that can play a role into this and change and mutate some of our DNA. But there are some other things that people need to be aware of. One of them, most commonly, is diet. I don't think people understand or realize how important diet is. It plays a very significant role in the risk of developing colon cancer. And many of the foods that we eat can increase our risk.
All right, Nurse Alice, as always, thanks for your time and your expertise on this.
Thank you for having me.
Take care.